My name is Nancy Steinfurth. I'm the Executive Director of Liver Health Connection, but I also have rheumatoid arthritis, and my nephew has type 1 diabetes, and my late father passed away from lung cancer. So lots of chronic disease in my family, as well as type 2 diabetes. I'm here because it's important to let legislators know how many people are affected by all sorts of chronic diseases, how some of the issues that we deal with, they don't think about very often, but they're powerful, they're traumatizing, they're significant, and they may have simple remedies that they can assist with. I have lots of things that I think about for my future. So for example, I may need a knee replacement or hip replacement because of my RA. I take lots and lots of pills. So one of them may lead to blindness, so I'm always anxious about what the medications are doing to me. I definitely have a lot more on my plate to keep myself healthy. So eating better, exercising a lot. Because of RA, I was denied coverage from a couple of carriers. And then I found a position that provided health care, and so I didn't have to worry about that, but I know it's tremendously expensive to pay for insurance when you've got a significant health issue. Even with the changes in through the Affordable Care Act, it's still a big burden for people. Mine are older medications, so they're not the latest and greatest therapies that become more expensive when they're just on the market. But other people are faced with really significant co-insurances, co-payments. My nephew has to pay a couple $1,000s a month for his test strips and his supplies for his type 1 diabetes, because he's a very active person and he tests himself frequently throughout the day, and they'll only cover a certain number of test strips, and then you have to pay a much higher price for additional supplies. So it's, yeah, big burdens. Everyone is dealing with a chronic disease, and there are a lot of people that don't know that they're dealing with a chronic disease.